Hey guys, Don here. Welcome to Podiatry Practice Mastery. This is my $1 million minute. This is something I do certain days after the day to kind of go over the patients that I saw. The patients today, I had a number of EPATs, so a number of shockwave. And what I tend to do, just as a reminder, after my third or sixth shockwave, usually I do 3 shockwaves, 6-week break to go to PT, and then another 3 if needed. So a patient came in, had the sixth one, and so I kind of go over more of the shockwave, what's to expect after, and then I do a level 3 office visit, and then I do a 3-month follow-up. So 6-week follow-up after the first sessions, and then double that, so a 3-month after the second session. Another patient that came in for orthotics, and then I also scheduled some physical therapy. So when I do physical therapy, I see them back in 2 months. That was a level 3 visit. Another patient with x-rays and then night splint, and then she scheduled 3 sessions of shockwave, and I'm going to see her back in a week to start that. That was a plantar fasciitis patient. Another shockwave patient. Another patient, he had first and second toes, both edges, matrixectomies. Another EPAT, a KeryFlex patient. I don't normally do them. This is the winter time here, or November, when I'm recording this. But I'm having some more patients. They want to do them year-round because they have the really short nails and they like the way it looks. Another patient that came in that had finished the Lamisil and the booster dose that I give them, all cleared up with the nails. Then what I keep them is on a maintenance dose of either a topical Lamisil once a week or ketoconazole once a week. But they also had a rash on their foot, so I did a 2 millimeter punch biopsy. So that was a level 4 visit because of the ketoconazole, and then the 2 millimeter punches, and then we're going to go over that when he follows up. He's traveling, so he lives far away in the Cape Cod area, so I'm going to actually call him with the results. I don't normally do that, but it might be a quicker way of doing that. Patient with a diabetic foot exam, 2 more shockwaves, shockwave number 3, shockwave number 7, and they're going to do 8 and 9. I don't normally get to 8 and 9, but occasionally I'm having to get there. Another patient, this is my orthotic number 2 patient, with a cortisone injection to the subtalar joint. That was a level 3 visit as well. Then I had a unique patient. You ever have these patients with the bulbous kind of bulb coming out of the tip of the hallux because of the nails not hitting there? So I do a bulbous T-taping where I tape horizontally and then longitudinally to pull down the tip. And so that they purchase that tape the same way they purchase Coban, 1-inch Coban. If they break a toe, they purchase this tape on the way out. And we talked about doing possibly an Onifix because she had some ridging in the toenail. And then another EPAT. So as you can tell, Mondays and Wednesdays are my EPAT days. So today is one of those days. Another IND, another EPAT. I did a couple of interesting EPATs, I think interesting. I did one for a neuroma today. I don't do a lot of neuromas, but I did a neuroma. And then a tibialis anterior. There's another shockwave for tibialis anterior. And then another kid with Seaver's disease. So did like the Thule's heel cushions. He already has orthotics, and he's going to be doing that. And then finally for this tibant area, I showed them on ultrasound, and they did EPAT 1, they're going to do EPAT number 2 and number 3, and then with number 2 they're going to do an amnio and a walking boot. So a couple of things also I've been kind of working on today. One of my members of my WhatsApp group, the Mastermind, recommended Cast Magic. It's a way of taking audio like this. I'm recording an audio. You could upload it, it transcribes it, and it can make a whole bunch of kind of AI derivated content. So it might be something like in terms of if you do like a recording about a condition like plantar fasciitis, you could record that and you could say, hey, make a blog article on this, make a website article, make an email I can send out to patients, make a worksheet for them. So there's a lot of things you can do. It's called Cast Magic. You can just Google that and you can find it. Also, I've been starting to tell patients to increase my online reviews. I'm saying, hey, you're going to get my patient education information, which is via Patient Education Genius, which is where I send it out. But then also at the end of the night, you're probably going to get a text from me to give an online review. Just don't ignore that. Just give us a review, please. And so I do that via Swell, which is another website. And then finally, I want to talk about x-rays. I think one way I do a lot of x-rays is my staff doesn't even ask me if I want x-rays. They know everything with foot pain, they get x-rays. So a patient today came in with like a porokeratoma and they got x-rays. Now I probably, if I would have looked at it first, no x-rays. But since my staff is doing it, everything with foot pain, they're getting x-rays. So and the Seaver's patient had x-rays. Maybe that makes sense. But anything with foot pain, my staff know to get x-rays. So those are the thoughts for this $1 million minute.